My name is Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we are going to talk about a very specific injury, and that's Carson Wentz, and we are Eagles fans here in this part of the country, so everyone seems to be very concerned about his back, and if you were in this clinic back when he went to play, I said he went back too soon, and it's funny, I'm getting emails back now saying, you said it, you predicted it. I said I knew he was going to have this week. He went back too soon. Doesn't matter. ACL takes time to heal. He did not give it the appropriate time, and here we are. Is his back pain coming from his knee surgery, and is it coming from the fact that he didn't rehab it correctly? Absolutely. Yes, it is. So one of the things you have to understand is everything's connected. You know, that old childhood song, the knee bone's connected to the hip bone, which is connected to the foot bone, and all that other stuff really does make a difference. And one of the things that I noticed right away, and it's really not obvious to people, but it does, if you look at him and you look at him run and you looked at him cut and you looked at him do a lot of things, it wasn't the same. And everyone argues, well, he had surgery. It shouldn't be affected that much. And it wasn't affected because he had surgery. He had range of motion. He didn't have the proper strength back, and he didn't have the proper balance back, and he didn't have the proper training to go back as soon as he did. And I know everyone, I've heard the armchair quarterbacks, I've heard the pseudo medical professionals say that ligament was healed, it was healed 3 months. There's a reason that there is studies out there saying it's a year before you should return to play. There's a reason that a lot of kids ride the bench for a year because they want that ligament to be healed. It is not an easy surgery. It is not something that you can just get back and go right back into the game. It is absolutely something that takes time to overcome, and it takes time to heal from. It is a major surgery, and the ligament has to be rehabbed correctly. It has to be rehabbed for the right amount of time, and you have to introduce everything at the exact proper time, and you have to allow it to be trained. And if you don't, you run into problems, and here's the problem. So why does he have back pain from a knee surgery that didn't heal properly? Or I shouldn't say properly, that's not the right word, but didn't heal all the way before he went out and played. So when you look at him run or you watch video of him, you're going to find compensation in his hip. You're going to find compensation in his hip. One, when you have weakness in one leg, it's going to affect both hips. So when you see him run, you're going to see more of a drop. You're going to see more hip issues. You're going to see shorter stride lengths. You're going to see a different type of running. And while all of this is something that he is not consciously doing, this is what his body's telling him to do based on his strength, based on how his ligaments are doing, based on how he's healing. It's happening. And he is now what we call compensated. And we see this a lot. And he has to compensate for the fact that that leg isn't strong enough and that leg isn't able to be out there playing NFL football. Is it strong enough for you and me? Sure. You know, but we don't play football in the NFL. We're not a quarterback for the Eagles. So when he has to go to that level of performance, his leg needs to be at that level of performance. And to watch him run and to watch him drop back and to watch him take a couple steps, there are some definite issues. And what has happened is his hips have started to compensate. And his lack of strength has caused his hip and his knee to compensate. Well, where does that go? It goes right up into the back. It goes into the hamstrings. It goes into the calf. Generally, it works as it goes into the hamstrings, which goes into the glutes, which goes into the low back. So that is the string of events that happens when you have a knee surgery not healed all the way, not healed correctly, and you wind up with that back pain. Now, if it was just you or I, we don't have to function at the NFL level. So would you be able to tell that we weren't properly healed? No. Does it take a year to heal from an ACL? Yes. All right. Even though all the outside healing is done and it looks great, it absolutely takes a year. The studies are there. It's been done, and we pushed it. And I know everybody knows someone who knows a professional athlete, who knows an Olympic athlete that's pushed it, and they've gotten back so much sooner, and they're just as good as they were before, even better. There is always an exception to every rule, all right? And the problem is we don't know what the exceptions are until we start pushing them. Carson definitely wasn't ready. His knee was not ready. And now he is suffering back pain because his knee wasn't ready to go, and he has got compensation going up the chain. So can your knee pain Even if you're not Carson Wentz, can knee pain cause back pain? And the simple answer is yes, it can. And a lot of times it does. And a lot of times it causes pain because you wind up compensating. So you may not stand on that leg. Let's say your right leg's sore. You may not stand on it for very long, which causes you to take more pressure onto your hip, more weight onto your low back, which allows unequal weight distribution. You may start to limp. You may not even realize you start to limp. I promise you, everything Wentz is doing, he doesn't know he's doing it. So this is not a conscious effort. This is not something that you would notice, but you might hold your foot up a little more. You might put a little less pressure on your leg as you're walking, and you're saying, I know I would notice this. You won't. Your brain is phenomenal at being able to tell your muscles and your body how to operate so you don't feel any pain. So you might feel pain in the knee, but you might not realize how much it's affecting you. When you go and you start to limp, when you have an obvious limp, you've been limping for a long time. When it becomes visible and you're able to see it, you've been doing it for a long time. It's just to the point where your muscles can't hide it anymore from you or the outside world. So you wind up limping. So, and then what happens is your hamstring gets tight, your quads get tight, your glutes get tight. You may wind up with a pain in the butt, literally, and then you have low back issues. So it is not uncommon if you have foot pain to wind up with back pain, or you have knee pain, so you wind up with back pain. It's a really common thing, and people tend to ignore it and just say, I have another problem, or they don't realize that ankle sprain that they had last year is now causing them back pain, and we have to work on the entire chain from the hip down to the knee, down to the ankle, in order for it to get corrected. So Carson Wentz has a lot of work to do. He's got a lot of muscles to retrain, and that's what happens when you wind up with compensation, and that's why your knee pain can cause your back pain, is because of compensation and because of issues that you're having where you're going to limp, you're going to change how you walk, you're going to change how you go up steps, how you sleep. Your body will put yourself in a comfortable position. Carson Wentz's body put itself in a comfortable position. It made it so it was able to do sort of what it did before. And to the naked eye, it can. You watch the tapes next to each other, it doesn't. RG3 is the same way. I've seen this time and time again with ACLs and football players. Put them side by side, watch the tapes. There's obvious differences, but because it's not really visible to the naked eye and you don't know what you're looking for, you're not going to see it, you won't see it. So same thing with you. If you're having knee pain, you're not going to notice that you're limping. And when you do, you've already exacerbated a lot of your muscles, so that compensation probably is in your back and in your hip and in, so if you are suffering from knee pain and then all of a sudden you have back pain, the two are absolutely almost 100% of the time completely related.